Hey there, I'm Dr. Vedkar, Director in the Editorial Admin of our very own podcast club of Edinburgh, and I welcome you all to Roadway to Your Future, a podcast series on the future, pros and cons of various medical specialties by pioneering experts in their respective fields to help you make an informed decision about your postgraduate career. Today, we have with us the very respected Dr. Aarti Heda, a renowned expert in the field of ophthalmology. Dr. Heda is a highly accomplished consultant and anterior segment surgeon based in Pune with an impressive academic background that includes MBBS, DNB, FRCS Glasgow, FACS, FICO, MRCS from Edinburgh, and multiple fellowships in cataract, refractive, and glaucoma surgery. She is widely recognized for her contributions to the field of ophthalmology, serving as the associate editor of the Global Journal of Cataract Surgery and Research in Ophthalmology since 2021. Dr. Heda is also an active member of various prestigious medical societies, including the core committee of the Medical Legal Cell of All India Ophthalmological Society and the Young Ophthalmologist Society of India. Her dedication to advancing ophthalmic care is further demonstrated by her role as the national coordinator for International Society of Manual Small Incision Cataract Surgeons and as a managing committee member of the Pune Ophthalmological Society. With more than 15 publications in peer-reviewed journals, Dr. Heda's expertise spans cataract, glaucoma, cornea, refractive surgery, and medico-legal aspects in ophthalmology. Her remarkable achievements include several prestigious awards, such as the American Academy of Ophthalmology Rotary Fellowship for 2024 and winner of the 2021 annual photo contest in cataract and refractive surgery today. Ma'am, it is our utmost pride to welcome you to our humble platform.
Thank you so much, Ved. I would like to congratulate you for this very wonderful initiative and unique initiative, which is going to be very useful for the upcoming generation.
Thank you, ma'am. That is very kind of you. To start with our session, could you please tell us about the current trends in ophthalmology in brief?
So, ophthalmology is one of the most growing branch of medicine with recent advances coming up every day. For example, treatments like gene therapy and stem cell therapies are showing promise in restoring the vision. There have been various advances in refractive surgery that is improving the visual outcomes and patient satisfaction. The newer intraocular lenses are improving the post cataract surgery vision without glasses. The virtual consultations and home based monitoring devices, especially for retinal and glaucoma diseases, are expanding patient care access. The stem cell research and neuroprotective drugs are being explored for various retinal diseases. There have been various advances in drug delivery systems. For example, there have been intravitreal implants that can help in treatment of diabetic retinopathy, that is reducing the frequent need for injections in the retina. And one more important thing, the artificial intelligence and the machine learning are enhancing early disease detection, especially the diabetic retinopathy and glaucoma, which they are called as very stubborn disease of in ophthalmology. And artificial intelligence is making their diagnosis and treatment very, very interesting. So all these recent advances are becoming the attraction for upcoming generation, especially for doctors who are looking for change always, wants to keep on learning new things.
Oh, as a future curious doctor, I must say that's surely insightful. Ma'am, moving on to our next segment, could you please tell us about the pros and cons of choosing ophthalmology as a career in near future? given your esteemed on-ground experience and observations regarding the field?
Okay, so I will not be biased to give the pros and cons. So let's start with the pros of the field. It's the high demand and job stability. I will talk about this first. So as the global population ages, there is an increasing demand for ophthalmologists. The conditions like cataract, macular degeneration, diabetic retinopathy that are more common in older adults, leading to high and steady demand for eye care specialists. With its essential role in healthcare, ophthalmology offers a very strong job security. Now, high earning potential. Generally, ophthalmologists are very well compensated for their work. This is especially true for those who specializes in surgery, for example, refractive surgery, cataract surgery, or those who work in the private practice. Good work-life balance with high income. So, compared to other surgical specialties, ophthalmology can offer a relatively balanced work schedule, which is one of the appealing aspects for many practitioners. Then it is a branch of combination of surgery and medical practice. So ophthalmologists, they perform surgeries which are often highly specialized and intricate ones, but also have opportunity for non-surgical clinical work. So that gives you a wide range of work. Then the high patient satisfaction level. So the ophthalmologists often see immediate results from their work, especially when performing surgeries like cataract removal or LASIK surgeries. So patients often experience quick and noticeable improvement in their quality of life, which can be very rewarding for the doctor. So improving the quality of life by restoring the vision or preventing blindness is an immensely fulfilling aspect of this field. So ophthalmology is highly technical field that employs the latest in medical technology, from lasers to robots to advanced imaging and diagnostic tools. So constant innovations make it an exciting and ever evolving field. Last but not the least, ophthalmologists can work in hospitals, private clinics, academic settings, or even in research. So the versatility in the work environment is appealing for those who are looking for flexibility. So these are all the advantages of going in the field of ophthalmology, I'll say.
Yes. Could you please elaborate something about the cons of the field?
Yes. So nothing comes with the cons. So let's talk a bit about that. Uh, it's a long educational path, I'll say. After completing MBBS, one must go for a 3 year residency. And after this, additional fellowships are becoming essential, which can make the training period even longer. So it's one of the competitive specialty, I'll say. It's one of the highly sought after field. So meaning competition for residency spots is very intense. It requires strong academic performance, research, and often additional skills to secure a place in a very good institute. Although ophthalmology is considered less physically taxing, some other surgical, in compared to the other surgical specialties, it still requires long hours, especially for surgeries. So surgeons must maintain their intense focus and precision for extended period, which can be mentally and physically exhausting at times. They often perform delicate fine motor surgeries, which can lead to strain or fatigue in hands, wrist, fingers over the time. Then, something which is very commonly talked about, managing patients' expectations. Ophthalmologists often treat older patients who may have a range of eye conditions. Sometimes conditions like age-related macular degenerations or let's say severe diabetic retinopathy lead to permanent loss of vision. And managing patients' emotional responses to such diagnosis can be little challenging. Then, while many ophthalmic procedures are successful, there are cases where a cure or correction is not possible, leading to emotional challenges for both the doctor and the patient. And it is very difficult especially in cases of children, to convince the parents that this condition cannot be treated. Then ophthalmologists, they rely heavily on specialized equipment for diagnosis and surgery. So malfunction or poor access to advanced technology can limit a practitioner's ability to provide a good ophthalmic care. I will say that.
Thank you so much, ma'am, for such a beautiful enlightenment into the field. Only a genuine doctor with a sea of knowledge could verify it so well. Could you please let us know the super and the subspecialization options and courses available for ophthalmology?
So certainly, ophthalmology has several subspecialties that focus on specific areas of eye care, surgery, and let's say research. The list is very exhaustive, and I'll just try to summarize it in short. So let's talk about one by one. So cornea and external diseases. It focuses on diseases of cornea, conjunctiva, sclera, and ocular surface. It includes the corneal transplant, refractive surgery, management of dry eye, keratoconus, and infections. So it is all about the external part of the eye. Then there is something called as cataract and refractive surgery, which is often spoken together. It specializes in advanced technique for cataract surgery, like phacoemulsification, femtosecond cataract surgery. Refractive surgeries options have been growing since past 2 decades, and to name a few, we have LASIK surgery, SMILE, PRK, ICL implantation. All these are cosmetic surgeries for vision correction. Then glaucoma, which is one of the very important and difficult disease to treat. It focuses on diagnosis and treatment of optic nerve damage caused by increased intraocular pressure. So the management include medical therapy, laser procedures, various surgeries, and now there are things called as minimally invasive glaucoma surgeries,
Yes.
which is being talked a lot in last 1 decade. Then there is retinal diseases, which deals with the minute part of the retina, like retina, macula, vitreous, and the diseases included here might be diabetic retinopathy, age-related macular degeneration, retinal detachments, various vascular diseases that can also affect the retina. The treatment for a treatment option for all the retinal diseases are intravitreal injections, lasers, and vitrectomy surgeries. Then the pediatric ophthalmology and strabismus is also one of the interesting subspecialty in ophthalmology. It specializes in eye disorders in children, including congenital cataract, amblyopia, strabismus, retinopathy of prematurity. And there are various surgical and non-surgical options for the treatment in this pediatric and strabismus subspecialty as well. Then there is oculoplastics, which includes orbit and ocular oncology. Then there's something called as neuro-ophthalmology that talks about the optic nerve diseases. It talk about the visual field defects, ocular motility disorders, and they are connected with the neurological conditions like stroke, multiple sclerosis, myasthenia gravis. Then there are other diseases which are related to uveitis and ocular immunology. Then other one of the very important and interesting subspecialties, community ophthalmology. It involves the public health initiatives, blindness prevention programs, and outreach services to provide accessible eye care in rural and underserved areas. So I think more or less I've tried to cover the related subspecialties here.
That's actually quite a galaxy of opportunities. Moving to the last segment of today's much awaited episode, ma'am, would you like to personally recommend students to take ophthalmology as a field for their futures?
So absolutely, ophthalmology is a fantastic branch, and I'll highly recommend it to future doctors. It's a perfect blend of, let's say, medicine and surgery, offering the opportunity to make a profound impact on patients' quality of life. Restoring sight can be life changing, and it can be very, very satisfactory. So you get to perform intricate microsurgeries while also managing the medical conditions. Now, many treatments like, let's say, cataract surgery, as I said, provide almost immediate improvement in vision, making it a very gratifying specialty. There are advances in artificial intelligence, lasers, minimal invasive procedures, making it an exciting and evolving field. Now, blindness prevention is a major public health priority. And as an ophthalmologist, you can make a difference worldwide. So, compared to other surgical fields, ophthalmology often allows for a more predictable lifestyle as well. So, I'm sure that you will be motivated by these highlights of, let's say, the field of ophthalmology.
Oh, for sure. I present the deepest gratitude from myself, the Rotaract Club of Medicrew, and all the medical students like me alike for this vivid enlightenment on the topic of choosing ophthalmology for our futures. This shall be of indelible help to all of us, future aspirants. Ma'am, I would like a few closing remarks from you.
So I'll say that I hope that this short discussion will be very useful for you and your friends and future doctors. Uh, I say that ophthalmology is one of a very interesting field, and you should definitely consider choosing it. All the best, Ved.
Thank you so much. It was an honor hosting you here. Thank you.
Thank you so much.